Hi, good morning. So I'm gonna perform an oral care. So first and foremost, of course, you check the patient's chart and then make sure you obtain any important information. Once you're done, make sure we wash our hands, of course, gather all the necessary supplies for this oral care, and also most importantly is we have to make sure we wear appropriate PPE such as gloves, mask, and even if possible, eye shield or goggles. So once inside, we introduce ourselves, explain the purpose of this, and then tell them that this oral care would help you prevent from being exposed to pneumonia or being from ventilator-associated pneumonia. So once you explain it to the patient, first and foremost is we have to check the patient's vital signs, and then we also have to inspect the ET tube. If they are on ET tube, of course, make sure we inspect what is their appropriate lip level, and then we also have to auscultate their breath sounds, and also we also have to check the suction wall outlet if it's secured or if it's the supplies are complete. And then when setting the appropriate pressure appropriately for adults is negative 100 to negative 120, which we should not exceed more than that. So after that, we also have a towel in place in the patient's chest to ensure that if there are pooling of secretions, it won't prevent from being pulled up to exposed to the patient's body. Also inspect the patient's mouth if there are any presence of ulcerations, oral trauma, or any inflammation. And then if everything is done, we can proceed in doing the oral care airway. So first is we have here the yonker. So with this yonker, we have to insert it in this one, and then also in the suction bato, suction catheter. So with this, we have to check and also make sure that we try to suction it first in a sterile water if possible to ensure that it's able to suck it up. So once you're done, we have to suck it inside to the patient's mouth. Make sure that we're able to not push it too deeply. We're able to prevent from pooling of secretions or from being risk of aspiration. And with the ET in place, there's an ET holder where we can try to change it up from each side, from left to right, or even from in the middle. So with that, we can try to prevent from the patient from pressure source from the ET itself. So after this, we have to put it on a safety bag. From in that way, this will not be exposed from any contamination. And then usually during oral cares, we do it every 2 hours. So after 2 hours, we have here another set of supplies. So first is we have this oral agent. So with this oral agent, we have to insert it again in here, and then we have to dip it up in here, and then we try to insert it to the patient's mouth. Also, we have to ensure that we clean it up on the palate, the gums, and even the tongue, and even the teeth. So once you're done, we dispose this one immediately, and then we have here another thing that we're gonna put a moisturizer. Make sure we put it the whole moisturizer in this green thing, and then make sure it's not clumping. And then when doing this, we ensure we put it on the sides, the cheeks, and even the gums, and also we make sure that we include it on the patient's lips to prevent from any dryness. So also, of course, we dispose it immediately. So after 2 hours, we're gonna proceed in our toothbrushing. So by the way, toothbrushing is usually done ideally at every 12 hours. So with the toothbrush, first is we insert it up in here, and then with the toothbrush, of course, we insert it also from the suction catheter. We also have to put solution in the toothbrush, so that way we're able to brush it in the teeth, especially on the sides and the back. And also when brushing it up, we can either do it in a circular motion, gently, but not too aggressively. So once you're done brushing, of course, dispose it immediately. And then we have here this green thing. So this applicator swab is we also have to put a moisturizer on it. So that way, with the moisturizer, as what I mentioned earlier, we have to clean it up on the cheeks, the gums, and also most of all on the patient's mouth to prevent from dryness. So when doing the oral care, also ensure that we always keep on moving the ET tube as always to prevent from being expose the patient their lips from pressure source. And then last and the least is we have here this suction catheter. So with this suction catheter, of course, when doing this one up, make sure we try to instill a little bit sterile water to ensure that this suction